evaluation and the effectiveness and the safety of the most commonly used combination therapy in hypertension from the day one, like telmisartan plus amlodipine in the Indian hypertensive patients. It was a study combining the cardiologists and diabetes experts from all over the country. So we had people like Jesse Mohan, we had Dr. Vivek, Rajiv Agarwal, and all the people are there. It was a huge study, countrywide study, but it's a very brief study and very simple study. It would evaluate the effectiveness and safety of telmisartan and amlodipine fixed drug combination in patients with hypertension, most commonly used combination therapy. So the primary objective was very simple, to see how much the blood pressure comes down, both systolic and diastolic. And secondary objective was to find out what are the comorbidities hypertension has in our country. That is very important to know. Number two, to evaluate this, whether there was any data for the adverse events. It was a prospective study, multi-center study. As you find, there was about 1,000 centers, 982 centers. Jesse Mohan wanted 1,000 centers. We had 1,000 centers. We had patients with hypertension. When it's a large number of people, it is very simple. It's a prospective multi-center observational study. It's a RWE, real-world study. There was no intervention, no prompting, nothing. See how the people treat diabetes, and are they giving the combination? What's happening to them? And we had a study for a very brief study, only for 8 weeks, and it was a telmisartan, amlodipine, FDC. The Lancet paper of metabolic map of India, Isomer India study came on the 7th June. This study was started on the 23rd September and it continued till 24 August 24. Now, dear friends, very simple, patients above 18 years of age, newly diagnosed patients with hypertension, where the SBP and the DBP was more than 140 by 90, equivalent to or more, and those who are on control on the monotherapy, already known diabetic, own hypertensive, on control monotherapy, having SBP, DBP same, 140 by 90 or more, were eligible for the study for the initiation of telmisartan and amlodipine fixed or combination as per the clinical judgment of the treating physician. It was left to the physician which patient they want to start the combination therapy. The exclusion criteria were simple, like any known hypersensitivity. We have found some patients, not in this study and earlier, any angioedema, women who were planning to have have children, biliary obstruction because amlodipine can produce biliary obstructive disorders, and severe hepatic impairment. Patients on concomitant use of telmisartan with alkeshiran, the renin inhibitor. Those were excluded. Patients who are prone to shock, including the cardiogenic shock, patient obstruction of the outflow tract of the left ventricle, that is high-grade aortic stenosis, we cannot give this combination to them, and patients with unstable angina, etc., etc. So we excluded those patients. Now, to make it very simple, the study outcomes were only two: changes in the SBP from the baseline to week 8, changes in the DBP from the baseline to the 8, and to describe the demographic characteristics of these patients, the comorbidities they have, and the concomitant medications in hypertensive patients. And to look at the safety outcomes, the number of adverse events or serious adverse events. Now, what are the results? We had about, and other point was that whether we can do such studies in India, large scale RWE in short time. Now, we had about in the beginning 8,541. We excluded from the study 2,309. As I told you, the cardiologist had very strict criteria for maintaining blood pressure. It has to be recorded on three occasions. Blood pressure must be 140 by 90 or more. So once detected hypertension can be white coat hypertension. Ultimately, 2,309 were excluded because the systolic blood pressure was not permanent. And 870 people were also lost to follow up. So we had selected 6232 patients, 1,892, 869 were lost to follow up. Finally, we had data from the 5363 patients, 5,363 patients. Now, this reflects something which is important. The age of the hypertensive patients, the mean was about 57.11 years. There are three other studies in the country. One study by when PHFI, Dr. D. Prabhakar and Dr. Srinath Reddy. There, the mean age was about 52. The study from the ICMR in-depth study showed mean age of the hypertensive was 51. In this study, it was 57.1, almost nearby but a little higher. And the height and weight are given here. But you see, they were all obese. Both visceral obese is not brought out here, but BMI was about 26.13. That is 3 point. I mean, it is quite high, and the therefore they were obese. Today morning we presented data. Dr. Naval Kumar presented that today the BMI for Indians have been lowered down to 23. It was Dr. Anup Mishra who gave 24, but this time he's here tomorrow. He is presenting that at 23. If it is 23, then 26 is a little high, quite little. It is in the overweight category, and maybe 27 will become the obesity category now. And if you look at the lifestyle, the people were torn active. There is a set of questionnaire given to know whether active or not active. It was about 3,586 were active, but still 2,646 were very, very inactive. So inactivity was measured by both leisure time and non-leisure time inactivity, and smoking was little higher in this study. And I have told you the known history of hypertension and how many have the duration of hypertension was exactly what we had found. Almost 6 years they were having hypertension. The history that we got. Diabetes, hypertension, both are silent disease. So the history only can say how many years they have it. Now, if you look at the reduction, which was the only objective, main objective, we found the reduction in the blood pressure was quite significant. It was the systolic blood pressure 155.17, 104.41 the diastolic blood pressure, and we found there's a significant drop in blood pressure, almost 20 millimeter mercury in the systolic and 16 in diastolic. I'll come to that in a minute. Now, we looked at the other things they had as a comorbidity. Dyslipidemia was about 20%. Chronic kidney disease was present about 4%. They didn't know that they had. Ischemic heart disease was about 2.5%. Heart failure about 1.39, and prior MI was in about 1%. You see the drugs list we have given here. Even though we know the SGLT2 is a paradigm shift in the management, none of the patients were on the SGLT2. That could have contributed to lowering blood pressure, but they were not on that. Metformin, glimepiride, you see the drugs they're using. SGLT2 was not in that. Now, if you look at the 8 weeks, how much BP came down, you will find that the systolic BP came down, as I told you, 19.16, and the diastolic blood pressure came down by 16.02. This is also clinical experience. Give double drug therapy from the very beginning. It is very easy to reduce in the beginning high blood pressure to low. Then it become difficult. It's only 8-week study, but the decrease was quite significant. 20 in the systolic and 16 in the diastolic blood pressure study. And we found that the patients who achieve blood pressure goal, that is less than 140, less than 90. Now the criteria is 130 by 80. We found that it was about 70% people uh, achieved the blood pressure goal at the end of 8 weeks. We have not studied further 8 weeks. And the safety, it was quite safe. There was only some cough in 5 patients. There was no adverse reaction. And if you look at the overall assessment, this is only, we just did a questionnaire for the patient satisfaction. Now the people were quite satisfied with the drug. The doctors were quite happy, and it was more or less the satisfaction score was quite good. So therefore, the mean age of the overall population of the hypertensive patients was 57.11, 55% males and 45% females. Hypertension history was almost about 67, with known hypertension was over 67.11%, with mean duration of about 6 years. See, even though they are known and 6 years, as was presented earlier, they were still quite hypertensive. About 44% were smokers, and about 57.4% is a questionnaire only said they followed an active lifestyle, and about 42% as a sedentary lifestyle. Mean SBP was 155, DBP 104, which a reduction of 19.16 in SBP and 16.02 with DBP by giving telmisartan amlodipine combination for 8 weeks. 70% of the study population achieved the goal of 140 by 90, less than 140 by 90. Most used dose in the study was telmisartan 40, amlodipine 5, Most common comorbidity was type 2 diabetes, about 72%, followed by dyslipidemia, 20%. The most common concomitant medication prescribed is metformin, followed by glimepiride, glyclazide. And totally 5 events could cut. So therefore, this is a fixed drug combination contributing effectively to reduce the systolic blood pressure by 20 and 70% study population could be brought back to normalcy.